Hey mama, if you are worried about tearing during birth, I want to reassure you from the very beginning that there are things you can do during pregnancy to help prepare your body for labor and potentially reduce your risk for tearing. In fact, research suggests that strategies like pelvic floor preparation, perineal massage, breathing techniques, and learning how to relax and lengthen your pelvic floor may help reduce the risk for more significant tearing. And today, we are going to cover several of those together. But here's what most women do not realize. Tearing isn't simply caused by having a big baby or having too small a pelvis. How your baby is positioned, how quickly your baby is born, how your pelvic floor relaxes, the way you push, and how your tissues are supported during delivery can all play a role. The good news, many of those things you can actually prepare for during pregnancy. As a pelvic floor physical therapist, I want to help you focus on the things you can control and not the things that you can't. In this video, I'll explain what actually contributes to tearing, how to reduce your risk, and I'll walk you through pregnancy-safe exercises and strategies designed to help you prepare your body for birth. My hope is that by the end of this video, you will not feel afraid, but you will feel more informed and more confident in what your body is capable of. Hi, I'm Dr. Towne, pelvic floor physical therapist, pre and postnatal exercise specialist, and a mom of almost 4. My goal is to help you feel strong, supported, and confident through pregnancy and postpartum recovery. But before we jump in, if you are looking for pregnancy-safe workouts, birth preparation, pelvic floor guidance, make sure to subscribe and turn on notifications. All right, mama, let's get into it. First, let's talk about what tearing during birth actually means. A perineal tear is an injury to the tissue around the vaginal opening, and it can happen during your baby's head or shoulders are being born. The good news is that most tears are first or second degree tears, and with appropriate care, they typically heal really well. Tears are classified by the degree. A first degree tear affects the skin and the external tissue. A second degree tear affects the muscles of the perineum itself. Third and fourth degree tears are more significant, and they involve the muscles around the anal sphincter or tissue going beyond that. Several factors may influence your risk, including whether this is your first vaginal delivery, how your baby is positioned, how quickly the baby is born, whether forceps or vacuum assistance is needed, the position you give birth in, and how your pelvic floor responds under that pressure. One factor that is often overlooked is your pelvic floor's ability to relax and lengthen during birth. One of the biggest misconceptions around birth preparation is that you need to make your pelvic floor as strong and tight as possible. During birth, it actually needs to be able to relax and lengthen and make room for your baby to move through your pelvis. And it needs to lengthen a lot. The pelvic floor can stretch to roughly 200 to 300% of its resting length during birth as your baby moves through. The uterus does the work of pushing the baby out, while the pelvic floor needs to get out of the way and allow that to happen. That is exactly why more Kegels isn't the answer when preparing for birth. Birth preparation should also include breathing, it should include mobility, pelvic floor relaxation, body awareness, and learning how to coordinate your breath with your pelvic floor. Other strategies may also help. Perineal massage in the last final weeks of pregnancy can help prepare the tissues for the stretching that happens during birth and may reduce the risk of more significant tearing. This is one strategy that I will be showing you today, so keep watching to see how I incorporate it. Using a warm compress on the perineum during the pushing stage of labor has also been shown to help reduce the risk of the more significant tears. The position you give birth in, the way you push, and allowing your baby's head to crown slowly when possible may also make a big difference. Of course, birth is unpredictable and not every factor is within our control. You can prepare well and still experience tearing. This does not mean that you failed or that you did anything wrong. The goal of birth preparation is not to guarantee a tear-free birth. It's to help your body be as prepared as possible for the demands of labor and delivery. And when we're talking specifically about reducing the risk of tearing, we're especially thinking about that final stage of labor when the baby is moving down and out of the pelvis. At this point, we want to create more space in the pelvic outlet, the bottom of the pelvis, so baby has room to move through. One way we can encourage this is actually through hip internal rotation. So with the knees in and the feet out. That movement actually opens up your pelvic outlet. Your pelvis needs to be able to move during labor and birth. So the exercises we're about to go through focus on pelvis mobility, creating space at that outlet, and helping the pelvic floor relax and lengthen as the baby moves through. Go ahead and grab a small lacrosse ball or trigger point release ball. And what we're gonna do is we're gonna externally release the pelvic floor muscles right in between kind of our tailbone area here and our sit bone area. So we're gonna work all along here. So we're gonna sit there, find a spot that's tight, feels restricted, hold, let it relax, and move to the next spot. So let's go ahead and find that bony prominence on our tush here. And then we want to put that ball, again, we're kind of right inside of it, and find a spot that feels tight and restricted, and hold and breathe. You want to feel that spot let go and relax. And if you feel like it's relaxing, one thing you can add in is a little bit of active motion. So we can bring our hip into external rotation and internal rotation. You'll find some good spots if you move that ball around just slightly. Again, in that area I showed you, and then internally and externally rotate your hip to do an external pelvic floor release. So make sure you're breathing here, inhaling through the nose, exhaling through the mouth, letting go of all that tension. So you'll keep moving that ball just slightly, finding new spots of tension and restriction. Then again, if you can tolerate, add in that hip motion in and out while you keep that ball in one spot. Make sure you do this on both sides and find those trigger points and let them release. Go on your hands and your knees here. So hands underneath your shoulders, knees underneath your hips, but we're actually gonna bring our knees nice and close and our feet are gonna go out wide here. What we're gonna do is we're gonna start in a rounded position. So our back is rounded up towards the ceiling and our pelvis is tucked underneath us. And it's gonna feel a little bit cramped and a little bit maybe uncomfortable because again, our knees are together and our feet are out wide. In this position, we're gonna go in and out of posterior tilts. So right now we are in a posterior pelvic tilt. So the pelvis is tucked underneath us. And then we're gonna drop that pelvis and go into an anterior pelvic tilt. So we're gonna go back and forth here. Make sure you're breathing. So you can inhale through your nose here. Breathe into that back as you do a posterior pelvic tilt. Exhale through your mouth as you do an anterior pelvic tilt. So really focusing on getting as much pelvis mobility as you can here, but the whole time our knees are in, our feet are out, and we're focusing on hip internal rotation. As a reminder, hip internal rotation is what opens up the pelvic outlet, which is how we are able to get baby out. And the more space we can get in that pelvic outlet, the less chance of that significant tearing that we'll have. All right, one more here. Round that pelvis, tucking it underneath you, and then let that pelvis go forward and do an anterior pelvic tilt. And then go ahead and just finish in neutral spine. And you can bring those knees and feet back. Nice job. Grab a slight elevated surface like a foam block or a couple textbooks and put your left knee up on that elevated surface here, and your right knee is going to stay down on the mat. We're going to go ahead and do a posterior pelvic tilt. So we're going to tuck that pelvis underneath us here, as then we're going to shift back into our hip on that left, really trying to get expansion into that left hip. Then shift forward, back so shoulders are over your hands. Then we're going to shift back. So we're really trying to open up that back of the hip, back of the pelvic floor as much as we can here. Make sure you're breathing here. Often we are tighter on our left side here than we are on our right, but you can always do this on both sides. I would just encourage you, if you're feeling more tightness on the left, then start and finish on that left side where there is more tightness. One more here, posterior pelvic tilt and shift. Nice job. Grab a large exercise ball, or you could also use an ottoman for this as well. We're going to go back into hip internal rotation. So knees are in and feet are out nice and wide here. Hands are on the ball or whatever surface you're using. We're going to inhale through our nose. We're going to shift our hips back as our hips again stay in internal rotation. So knees together, feet out, hold there, and then slowly come on up. So we're doing rock backs here. So we rock those hips back as far as we can, with knees staying as close together as possible, feet staying out. So this is gonna get a good stretch in our back and also those hips. We're stretching into, again, that pelvic outlet, which is where baby needs to be able to go through with, again, the more space we have, the less risk of that significant tearing here. So that's why that hip internal rotation is so important for this one. And then again, we're going to keep rocking those hips back as we push that ball or that surface away from us here. It's a really good stretch through the spine as well. All right, couple more here. Good breathing. Hopefully that pelvic floor is feeling nice and relaxed and letting go of all of that tension. Perineal stretching can help release the muscles that are difficult to get to externally, and it can introduce your body to that stretching sensation of birth and may help decrease the risk of tearing, especially for first-time moms. Insert a clean finger vaginally or thumb, or you can also use a pelvic floor wand. I have one on my favorites page along with a discount code. So you can insert that vaginally, gently hook it into the pelvic floor, avoiding direct pressure towards the direct back, towards your tailbone, or the direct front. We want to work the pelvic clock. So think of top as 12, bottom as 6. We want to be working 3 to 6 and 6 to 9. We want to hold the stretch for about 1 minute at about a 3 or 4 on the pain intensity scale, enough to feel a stretch without significant pain. As you hold, keep breathing, relax your shoulder, relax your jaw, and allow your pelvic floor to relax. The goal is also to help your brain become more familiar with that stretching sensation before birth. For a full step-by-step perineal massage tutorial and exactly how I recommend my patients do it, watch the full video that's included inside the Strong Expecting Mama program. I hope this video helped you understand that while there is no promise that you won't tear during birth, there are actually things that you can do to feel more prepared. Learning how your pelvic floor works, practicing pelvic floor relaxation, improving pelvic mobility, creating space through that pelvic outlet, exploring different birth positions, and coordinating your breath can all help you head into labor with more awareness and confidence. And remember, if you do tear, it does not mean that you failed. It does not mean that your body was broken or that you pushed incorrectly or that you weren't prepared enough. Birth involves many factors, and some of them are outside of our control. The goal isn't to achieve a perfect birth. The goal is to feel informed, supported, and prepared for whatever your birth brings. And these are exactly the kinds of things that we go deeper into inside the Strong Expecting Mama program. We cover birth positions and pushing techniques that can help reduce tearing, a more in-depth perineal massage tutorial, and also entire exercise classes dedicated to pelvic floor labor prep. You'll also learn how to help your pelvic floor relax and lengthen, how to create more movement through your pelvis to prepare for birth. So you're not just doing exercises, but you're understanding why you're actually doing them and how you're supporting your body in labor. Click the link below to start your free 3-day trial and see if it's the right fit for you. Once you get started, use code YouTube10 for 10% off every single month. And if this video helped you feel more confident and more prepared for birth, make sure to like, subscribe, and turn on notifications for more pregnancy-safe workouts and pelvic floor education. And send this video to another expecting mom who has been worried about tearing, because understanding what you can control can make birth and the whole experience a lot less scary. I'll see you in the next video.